Sound advice to keep your body and mind in perfect harmony. You're tuned in to the Dr. Stephen Show. Now, here is Dr. Stephen Eisenberg.
Welcome, welcome, welcome everybody to the Dr. Stephen Show. Thank you for being here. Am I blessed? I mean, I just happen to know the best doctor in the world. And we have him here today. His name is Alex Haddad. He's a doctor whose mission is to enable people, either as individuals or groups, to live healthy and happy lives, full of love, and with no regrets until the last breath. I consider Alex my brother. We met at Exponential Medicine. It was the best time of my life. He taught me about relationships, how I could be a better husband, a better doctor. He touched my soul. And today we have him here, and he's going to touch 7 billion souls. We have with us Dr. Alex Haddad, who is the head of Global Health Equity and Innovation at the University of Toronto School of Public Health. We'll be right back with more with Dr. Alex Haddad. Thanks for coming, everybody. We'll see you in a minute.
Because you need to know.
Because you need to learn.
Because financial planning can be complicated.
There's wealthed.com.
Wealthed.com.
The site dedicated to educating you about financial planning.
With guidance from experienced financial planners.
Helping you learn more about creating your financial plan.
Watch Bucket Strategy Investing, presented by Lucia Capital Group, every day at 1 p.m. Eastern, 10 a.m. Pacific. Or watch archived features from the show on demand.
Learn more about options for your benefits on the Social Security Show every Tuesday afternoon at 4 p.m. Eastern, 1 p.m. Pacific.
Lucia Capital Group brings you Bucket Strategy Live, Wednesday evenings at 9 Eastern, 6 Pacific.
And learn more about the challenges women deal with on Femme Finance, Thursday afternoons at 4 Eastern, 1 Pacific.
It's the site where understanding financial planning can start to click.
Click on wealthed.com.
Live programs, on-demand archived features, and articles.
Go to wealthed.com.
Wealthed.com.
And we are back. We are live with Dr. Alex Haddad. Alex, thank you so much for being here. My brother, my amazing friend. I'm so blessed to have you here today. We worked it out.
I'm delighted and honored to be here.
I consider you to be more than just a guru of medicine. You are a stand for humanity. Meaning what I mean by that is your life's mission is to have 7 billion people be happy, healthy, full of love. I mean, how do you even start to embark on this journey to go from Colombia, being born in Colombia, coming up, going to medical school, and now director of this amazing institute? Give me a little bit of background on how it all began.
Well, first of all, thank you for all those kind words.
It's the truth, man.
Well, thank you.
You're too humble. I love you. Go ahead.
Well, it really began because I realized that that's what I wanted for me and for all my loved ones. What could be better than to experience health, happiness, and love until our last breath? And then I started to work with some colleagues from around the world looking for data. And what we discovered is that we are closer than we think to having a true pandemic of all of those good things. A pandemic of health, happiness, and love. It seems that about 70% of humans, when they are asked about how healthy they feel, they say that their health is good, very good, or excellent. About 70%.
70.
We have data from about 116 countries, more than 600,000 people who have been surveyed. And
but how can that be? How can 70 people, 70% of humanity,
of those who have been surveyed, and we have data from about 2/3 of the countries in
Because
the
all
world.
we hear about on the news is the tragedy and how healthcare is so bad, and the poverty, and you know, the politics, and all of this horrendous things going on in the world. It seems to me that that number 70%. How can that be?
Okay, so it has to do with what we mean by health. Okay? So if we believe that health is the absence of disease,
Yes.
then very few people would be considered healthy. Remember,
correct.
Stephen, you and I have been trained as physicians,
Yes.
as doctors. So
Yes.
if anybody gives us 5 minutes, we would diagnose something.
It's true.
And we are trained basically to diagnose and then to fix what we diagnose.
Yes.
However, when we ask people,
Like a
how they feel-
mechanic.
Yeah. Unfortunately, like mechanics, in an inefficient franchise of repair shops, yeah?
Right.
So which we call the health system. It's not a health system. It's a disease system or a
Right.
disease industrial complex.
Yes.
But when we ask people how they feel, and they're validated tools, okay, the American version of the tool is, in general, how would you consider your health to be? Is it poor, fair, good, very good, or excellent? And I would like to ask the people who are watching us right now, how would you consider your health? Is it poor, fair, good, very good, or excellent? And I bet to you that most people would say, my health is good, or very good, or excellent. And this is what is at the heart of these surveys that we are collecting from all over the world. When we are putting all this data together, again, more than 600,000 people from 116 countries, when we combine the data, we were surprised to see that that's the case. So the question is why? And then we looked at other studies and found that even people with chronic diseases, even people with terminal cancer, they know that they have cancer. They know that the cancer is incurable.
Yeah.
When they are asked about how they consider their own health, in 2/3 of cases of these patients with terminal cancer, they say my health is good, very good, or excellent. Okay?
Wow.
The question
that hits
is,
home. That hits home hard over here.
well, yes.
Yeah.
So health is more than the absence of disease.
Wow.
Health has to do a lot with our ability, our capacity to adapt
Yeah.
and to manage the physical, mental, or social challenges that life presents to us. And it has a lot to do also with resilience and with our expectations, and relatively little with what we doctors consider to be health. And it hit home also for me in the year 2008 when I thought I had cancer myself, and I found myself as a patient in my own hospital being
What
studied.
happened? What happened?
I thought I had colon cancer. And then when I was about to go for a colonoscopy,
Yeah.
I thought, what if I have cancer? Could I be healthy? Because I want to die healthy and I want to die happy.
Yeah.
Would it be possible? And then, horrified, I realized that I didn't know what health really meant. You see. And then I started to look at it and found myself at one of the celebrations of the 60th birthday of the World Health Organization.
Yeah.
And I couldn't resist the temptation. I asked the question. I said, what is health? And then people gave me the usual definition, which is health is a state of complete physical, mental, and social well-being, and not just the absence of disease. But who can have complete physical, mental, and social well-being? Nobody. So that definition that we used when, as humanity, we created the World Health Organization, basically made us all not healthy. Because if you wear glasses, you could not be healthy from a medical perspective. These are prosthetics.
Yes.
Your glasses, you
Yes,
see?
they are.
Yeah. You see, when you didn't have your glasses on, you didn't have complete physical well-being, because if I showed you some text, you couldn't read it. Now with your glasses on, you're adapting and you are adjusting to that physical challenge. So tell me, Stephen, how would you rate your health? Is it poor, fair, good, very good, or excellent? How is it now?
Good.
There you go. But you're wearing glasses. So from a medical perspective, you're the patient of an ophthalmologist
Yes.
or an optometrist.
Yeah.
Yeah?
For
But
sure.
from your own perspective, you're healthy.
Yeah.
So who has the legitimacy to consider you healthy? Is it you or a professional who would be measuring things in you?
brilliant question.
Isn't that an interesting one? So,
Yeah.
so medicine.
I would say me.
Me too. So if about, you see, it ranges about 60 to 90% of people with diabetes. When you ask them about their own health,
Yeah.
they say, I'm healthy. You see, 90% of people with arthritis. And it's like most people, even when they know that they have chronic diseases, they
Yes.
would say that they feel healthy. So the question is, why? You see, and what are the factors that make some people feel healthy and others to feel not healthy when they have similar challenges? And how can we, you see, identify what could help us not only to create health,
Yes.
but also to make it contagious? And how can we ensure that it spreads to 100% of humanity? And the word pandemic we are using on purpose because we tend to associate it with diseases.
Yes.
But the etymology of the word, the origin of the word comes from two terms: pan, which means all,
Yes.
and demos, people. So a pandemic is something that affects all people. So how about switching it for a more positive view, okay? And say, if we are at 70%, or if that you see in Colombia, for example, my origin, my country of birth,
Yes.
over 80% of people now consider themselves to be healthy. Okay? And we have data from over 300,000 people just from different subgroups there. And it's fascinating. So the question is, what would it take to...
Can we run an experiment live here on this show? Can we ask everyone who's watching right now to reply
Why not?
with the hashtag Alex on Dr. Steven?
Okay.
Ask him the question again.
How would you rate your health? Is it poor, fair, good, very good, or excellent? Let's do it.
And write us right now using that hashtag, and I will collect the data.
Or it could be hashtag pandemic of health.
Ooh, that's better. Hashtag pandemic of health. I want you to, no, do they write out the name, or do they just put a number next to it?
No, it would be great to have poor, fair, good, very good, or excellent.
Okay.
And let's see what
Pandemic
happens.
of health. I want one more time
Poor, fair, good, very good, or excellent.
with the hashtag pandemic of health, and we're going to get back to you on the next episode with the results.
That would be fantastic.
Yeah.
So the question is, because I would like to be in that group, if we live long enough, we are going to be collecting chronic disease.
It's true.
So does it mean we should be condemned to be not healthy? I want to be a member of the group of people who consider their health to be good, very, very good or excellent. I want my loved ones. I want everybody in the world. Why not?
Despite the chronic disease.
Yeah, despite the chronic
Because
disease.
we tend
The data show that. So
Yeah.
pretty much every survey that we have found in the world in which people with chronic conditions are asked about how they perceive their health, most people respond, my health is good, very good, or excellent.
Now how do we help the people with the chronic conditions who take on the burden of the disease and their life becomes the disease, and they're answering poor or
Fair. And those people have twice the death rate of their peers who say my health is good, very good, or excellent, and they consume more healthcare resources too. So when somebody says my health is poor or fair, I would say that that is an emergency. And the question is why? Why do you feel that your health is poor or fair? And what we are starting to unearth, to discover, is that in many cases it has to do with symptoms, with fear of what could be,
Oh, yes.
with stress, you see?
The fear is on top of
Yeah,
fear.
it's
They're
not
having
the
fear
disease
over love
itself.
instead of
It's
love
not-
over fear.
It's not the disease itself.
The fear of symptoms.
Is the fear of the consequences of the disease, is the suffering that the symptoms cause. Okay? So I would say first, realize that you could be healthy even with the disease. Two, if you feel that your health is poor or fair, then try to find out why. Yeah? And communicate that to your health professional and see if together you can find a way to deal with it.
Yes. And what would be like their first? Well, the first step is to look, and then
First thing is to realize that it is possible to be healthy even when you have one or more diseases,
yeah,
even terminal disease.
yeah.
and to say, yes, this is possible. Most people with my own condition feel healthy. Why am I not feeling healthy? And try to put a name to that, and then share that information and work together with a person you trust within the health system.
This is so brilliant. It reminds me of this movie I recently saw called Happy. Mm-hmm. And they went all over the world and they asked people what made them happy, and it wasn't the money. It was the bonds and the connections they had with their neighbors and their families, and that human connection was the more important than the amount of money. Once you got over a certain...
Yeah, once you satisfy your basic needs, yeah, so the ground gets leveled.
Yeah.
It would be wonderful to talk about a pandemic of happiness.
Yes.
What do you think?
Yes, a pandemic of happiness, of health, and love. Mm. We're going to get back into this on as soon as we get back. We're going to take a quick break. Shout out to our sponsor, wealthed.com. We'll be right back with more on the Dr. Stephen Show with Dr. Alex Haddad. Come on back, people.
It's the site where understanding investing starts to click. Click on wealthed.com, educating you about financial planning and answering your most important questions with live interactive shows hosted by experienced financial strategists and an on-demand library of videos and articles you can access anytime for free. Wealthed.com brings you retirement planning guidance, social security strategies, tax management techniques, portfolio allocation options, and more. Your source for information and financial education. Online, on demand, on wealthed.com.
And we're back with Dr. Alex Haddad, my mentor, I want to call you the love guru.
He's terrible, isn't he?
I want to call him I want to call you the love guru, the master of medicine, because medicine to me is really about that connection and that love, and to bring the joy and happiness back to medicine, to bring joy to the patient-doctor relationship, so doctors can once again practice medicine and feel the joy of helping a fellow human, and the patient can feel that bond with their doctor again.
But Stephen, I think most of us would like to do that.
Yeah.
Okay? And if we remember why we went into medicine in the first place,
right?
You see, the typical answer in the interview is, I want to help people.
Yes, of course.
I want to devote my life to enabling others to feel well and all that. Along the way, things
change.
Do you
know a lot of doctors who are not happy?
A lot, unfortunately.
Yeah.
We might need to put our oxygen mask on first.
Mm-hmm.
And I think we are spending a lot of time putting the oxygen mask on other people. And,
I love that analogy.
And like on the airplanes, when we are flying, before we take off, what is the message? The message is, in the event of a decompression, oxygen masks will drop, grab yours, and put it on first, even if you're assisting somebody else, even if you have a baby.
Yes.
Put your own mask on.
What would that look like for a doctor?
Is to realize that we are at risk. Mm-hmm. At risk, you see, studies show that about half of medical students are burnt out.
And doctors.
More than 2/3 of residents are burnt out.
Before they're even out there practicing.
With compassion fatigue and exhausted and at some point not even caring about this beautiful mission. So we need to realize that we need to pay more attention to ourselves. We need to love ourselves more, and to acknowledge that unless we do it, we are going to be much less effective. And so
I call that CPR for the soul.
Mm-hmm.
Compassion, presence, and resilience.
There you go.
CPR. Yeah. Compassion, presence, and resilience. We have to sort of be jolted.
And I would like to add the element of self-love to that.
Self-compassion, self-love.
I am emphasizing love on purpose, because the root of compassion, you see, compassion comes from, again, two terms, com and passio, which is to share suffering. I think we need to put the passion back into the picture.
Yes.
Okay? Because it's passio, suffering. No, in this case, it's passion. And how could we love others unless we love ourselves? And this is the golden commandment.
Yeah.
You see, love your neighbor as you love yourself. So how could we love our patients? How could we love other people if we don't love ourselves? So I would really like to issue a call to pay more attention to self-love, which is not selfishness. We're not talking about selfishness or narcissism. Is to be tuned in, you see, with what is important to us and why we are doing what we're doing, and to seek support. I think that love is a team effort. It's a plural word, just like health or happiness.
Yes.
And so...
What's the first thing a patient or a doctor who's listening right now or watching right now can do to increase their capacity for self-love?
I think we need to press the pause button. Imagine that we have a pause button and press it and stop.
That is beautiful.
And stop, okay? And breathe and say, okay, where am I at? How am I feeling? How much am I loving myself? Because love is to wish good, but we tend to say to wish good to others. How about to wish good to yourself? Yeah? And then to say, what makes me happiest? You see, what tickles my soul more than anything else?
What tickles my soul?
And how much am I doing that? You see?
Yeah.
But to pause.
Now this tickles my soul. This.
And it tickles mine too.
Being here with you and getting your message out into the...
Well, it's a message of a lot of people, and there is a group of people that is growing from all over the world who believe that this is possible. This is not science fiction.
How can people join you on your quest? How can people follow the research that you're doing? And it's beyond just health, it's happiness.
And love.
And it's love. Health, happiness, and love. How can they join you in your quest? Can they come and do your class? Can they find, I mean, how do they join the love train?
Okay, first of all, to visit our site at the Institute for Global Health, Equity and Innovation.
Yes.
So
what's the website?
It's IGI. I-G, Institute for Global, H, Health, E, Equity, and I, Innovation.org.
Good. I want everybody to go
and
there.
Send us to begin with an email message. We are developing all sorts of initiatives there, and we're going to be launching them.
This is a global initiative.
This is a global initiative, and for us, equity is a very important thing. We want
equity
because we believe that every person in the world should have the same opportunity for a long, healthy, and happy life, full of love and with no regrets until
to their last breath.
Yeah. So then happiness is a very important concept as well. And these
do people tell you, oh, this, you know, that's all great, Alex, you know, love, happiness, but get real. You know, this is a real world out there. You know, there's a lot of bad things going on. You know, what do you say to those people who are like the naysayers, you know?
That this the most likely scenario is that we are doomed. That there is nothing we can do to change the course of history, that we are accelerating our extinction. So yeah, you're probably right, but what if we're wrong? What if we made some effort together to prove that we are wrong? And that we can get away with happiness and health and love.
That we can get away with
it. So let's give it a shot. If not, okay?
Yeah.
If not, then what's the point?
Yeah.
So, but these words are very complex, and for us in our professional lives, Stephen, it's very difficult to bring them up because people would say that same thing. Okay, let's talk about diabetes and cancer and high blood pressure.
You can't write a song for all your patients.
You cannot sing exactly, and you're one of the very few people I know in the world, and I love you more even for that, and many reasons, but this is one, which feels very comfortable talking about these issues, which are very important to us as individuals in our private lives.
I see you as the world leader on this subject.
No, I'm just a voice for many people, and there are others who are joining in.
But you're out there on an international level, and you are speaking this into the world, and people are listening, and people are starting to take action.
And more people are out in the world delivering the message.
I just read a beautiful study where there's a certain tribe in Africa who now have smartphones, and they said, is their quality of life better or worse? And their quality of life was better because they were using the phone for what they always have been doing, finding food, crops. And so they're not, buying books on Amazon, but they're actually using it for their own social good in their own, like you say, global. Mm-hmm. So it's global technology, but their local lives were improving. Yeah. They were getting better health care.
And they should be very careful, because probably these mobile technologies for the rest of the world are a hindrance. They're starting to reduce our quality of life.
Yes, there's a fine balance.
And I think the balance is tilting towards the negative. So what if we use those tools to promote greater alignment? And we are now looking at over 2,000 publications on happiness in relation to health, and creating conceptual maps. What do we mean by happiness? And it seems to have a lot to do with alignment, aligning. And this is paraphrasing Gandhi a bit, who said that happiness is what happens when what we think, what we say, and what we do are in harmony. We are adding one piece there, because you can think, say, and do something that may not be that meaningful to you. Mm-hmm. How about feeling? Putting, what you enjoy most, what you find most meaningful in your life at the base, and say, let's align what I feel, what I think, what I say, and what I do. Okay? And that alignment, the feeling. So a question that those friends who are watching us now should ask is, what makes me happiest in life? What is my verb? What is my verb? What is that action that reflects what only I know about myself, what makes me happiest? And then figure out how to guide your life on the basis of that. How can you get away with doing that as often as possible? And then ask other people, what's your verb, Stephen? What's your verb? What makes you happiest in
create
life? Your verb is to create. Mine is to wonder.
Oh, I love it.
What makes me happiest is not to know. You see? So my love for uncertainty makes me, express that through wondering, through questioning, and you love to create. So imagine us now helping each other to become accomplices. So I would help you create as much as possible, and guess what? Please help me wonder as much as possible.
Oh, man.
And then what if we did that within our families, within our workspaces, within our communities, and enabled each other to do that we love more than anything else? Then that pandemic of happiness, and in this case, self-love.
Yes. Can we talk about this issue of digital distraction, of how we're walking this tightrope, and we may be falling off to one side, that we're spending so much time on our devices that we're not looking up. There's a whole hashtag, look up, be with people. And that's the one thing that when I first met you that struck me to my core, was that you were with me 100%. And you told me, every month that I'm with my wife, you get another month. That your wife is the CEO, and she allows you to have one more month of marriage. And it just drilled it home. Happy wife, happy life, whatever you want to call it, but you got one more month together. And ever since I met you, that's how I've been approaching my relationship with my wife.
Okay, what can I say? The credit goes to Martha. Probably my only credit was to realize that I was in trouble, and that I was my worst enemy, that I am my worst enemy, and I cannot help myself, that I needed help from others who loved me more probably than I deserved. So I declared Martha the chair of my personal board of directors, and enlisted other people, with time our daughters, and then my closest associates at work and my closest friends. And I asked them for help. So then Martha started evaluating me. When we started dating on the 12th of March of 1981, We were best friends, and she was worried about our relationship. And she said, I don't want to sacrifice our friendship. This is too valuable. I said, give me a month, please. And if in a month we are doing well, we'll reassess, we'll decide what to do. So a month came, and I said, how are we doing? I said, we're doing great. Would you give me one more month? And now it's more than 720 months later.
720 months later. Do you still have that board meeting every month?
Yes, and our daughters assess me on the 4th of each month on how to be the best possible dad. My assistants at work and my colleagues, as often as they can.
This is just...
But this is again self-protection. I think this is part of self-loving.
Can everyone who's listening or watching create their own board meeting?
Yeah.
The way you did?
One key question, though, is who do you trust? Who would be with you during some of the most difficult and scariest moments of your life? And then invite those people to help you, to support you, to experience a full life, which includes intense self-love,
and what questions?
Happiness,
what
and
would be the most important questions that they would ask the other board, the CEO of their board meeting, on their monthly board meeting?
First is a request, and the request is to help you protect from yourself. But that requires some work beforehand.
Yes.
You need to realize that you're at risk.
Yes.
If you are left to your own devices.
Yes. So
worst enemy. I'm my worst enemy. Nobody can hurt me more than myself.
So, in your opinion, what can I do to protect myself against myself?
Yeah.
From myself.
Then I ask somebody who knows me a lot, who loves me a lot, even if I don't deserve it. Yeah.
Yeah.
Especially when I don't deserve it, and say, I want you to play a protective role in my life. Would you do it? Okay. The person probably would say, do you really mean it? Okay. I said, yes. Okay. How could I be a better person? How could, you see, be better to other people? Give me feedback.
And you have to be willing, right? You have to be open and honest and be willing
and
to
And
hear.
to ask for specific tasks with specific deadlines, and to be monitored, and to acknowledge that this will not be easy. And that the other person needs to be explicit, to spell it out very clearly, and to invite you to repeat it, and to make sure that you understood it, that the person is reasonable, that the goals are set at a level that you can achieve. And 3, patience is a very important one. It will take time, longer than we all want. But with this collective act of love, the chances for that becoming real are much greater.
Now, you mentioned pushing the pause button. I want to leave today's episode with something very special. How can everyone out there push their own pause button? Is it meditation? Is it just self-love? I guess is it different for everyone? What is an accessible way in your experience, my guru of love and medicine, for them to push their pause button?
Again, the first, and I have been privileged. Martha says that I am the vehicle for hundreds of dead friends. I have had the fortune, the privilege to be with people through some of the most difficult times of their lives, especially at the end. So the credit goes to them. I have had the opportunity to interact with a lot. And then I started to switch this experience to earlier times, because sometimes at the very end of life, when you are diagnosed with a terminal disease, you don't have energy to go through this. So the earlier we do it, the better. So I would say, first, be aware that you need to stop and value even a few minutes with yourself. My plea is for permission to oneself to slow down and to stop and to say, where am I in my life? How happy am I? How much am I loving myself? How healthy am I? Am I hurting myself? Who could help me? And to stop and reflect. And if you cannot do it, then go for the person who is closest to you and say, I need help to stop and to slow down and to give myself permission to love myself more.
Beautiful, beautiful. Well, wow. Let's end on that note. Thank you for being here. You are just I'm going to say, a living legend and an angel. And I'm so blessed to have you here today. This message of this show is to push the pause button in your life and ask those who love you to have a board meeting once a month. Ask your significant other to, if you can have one more month. And thank you for being here. Ladies and gentlemen, Dr. Alex Jadad, and thanks, man.
What can I say?
And we will see you next week,
Thank
everybody.
you for the opportunity to share this time with you.
Yes.
With all of you.
Yes. And come back next week, everyone. Lots to think about this week on the Dr. Stephen Show. We will see you next week. Bye, everybody.
It's the site where understanding investing starts to click. Click on wealthed.com, educating you about financial planning and answering your most important questions with live interactive shows hosted by experienced financial strategists and an on-demand library of videos and articles you can access anytime for free. Wealthed.com brings you retirement planning guidance, social security strategies, tax management techniques, portfolio allocation options, and more. Your source for information and financial education. Online, on demand, on wealthed.com.